Hey everybody, this is Dr. Buckley, and we're going to demonstrate the components of the pre-participation physical, and we're also going to explain what we're looking for so that it becomes a very, very functional, a very easy, and very natural progression about how you can do an examination. Now remember, pre-participation physicals, and we're going to be doing mostly high school kids and kids probably from the 1st through 8th grade. The purpose of a pre-participation physical is to find out what's right with them. A normal exam in the office, in the typical setting, is to find out what's wrong with the person and how to fix it. In the pre-participation physical, we're looking for a lot of normals, and we want to find out what's going on. So we're going to be doing many things that will involve range of motion, alignment, structure, strength, function, and stability. So I'm going to run through the whole physical, then we're going to go through the individual components to understand about why we're doing what we're doing and how they all work together. Okay? Now, the interesting thing about this, if you want to, time how long it's going to take me to do this physical. We have our willing participant who is in high school right here.
Should I pretend like I'm spun out on sugar and ADD? Because that'll make it more realistic.
Okay, so I'm going to run through the whole examination, how it would go. So we'll stand sideways like this so we can get a picture on that. Hi, welcome. I'm going to do an examination on you to see if you're ready to participate in sports. Are you ready? Okay. Well, first thing I want you to do is I want you to bend forward and touch your toes. Good. I want you to come up. I want you to put your hand on the back of your leg and lean back. I want you to put your hand on the other leg and lean back. I'd like you to walk on your tiptoes. I'd like you to walk on your heels. And I'd like you to do a squat all the way down. Good. Come on up. Now put your hands up over your head as high as you can, to the side, out in front of you, and down. I want you to look at the ceiling. I want you to look at the ground. I want you to look at me. Turn your head to the right as far as you can go, to the left as far as you can go, and look straight ahead. Put your ear to your shoulder, ear to your shoulder. Look at me. Follow my finger with your eyes. Don't move your head. Follow it in. Open your mouth, stick out your tongue. Say ah. Shrug your shoulders up really tight. Put your arms up really strong like this. Stop me from pressing down. Squeeze my hand real hard. Squeeze this hand real hard. Okay. Let's have you take a seat right here. So those are all the standing tests. Now, this is what you do seated. Take a deep breath in through your nose, out, in, and out. Put your arm up like this. .08 over 60.
Like a teenager.
And pulse to 60. All right. Do you have any pain in your stomach with coughing or sneezing? Right. Basically, that's the whole examination right there. If you add it up, it probably took about 3 or 4 minutes. Okay. So now what I'd like to do is to kind of explain what we did there and how we've combined things to look at a person, how they function globally. So go ahead and stand up again. The first thing when you're meeting someone, you're assessing their posture. Looking at their shoulders, look at the way they're standing, look at the way their head is, look at the way they can talk. Can they hear me? Can they see me? Can they follow instructions? That'd be very important. When someone first does, the first thing we're doing is a dorsal lumbar range of motion. When they bend forward and touch their toes, we're doing flexion, but then we're actually doing a test. We're actually doing lateral flexion and a rotation, also with this called a standing Kemp's test. It's a compression test all at the same time. When we're doing that, we're also looking at range of motion and does it move fully. Then we have them walk on their toes and their heels, and that's basically testing lower extremity balance, lower extremity strength, and also in the two planes, whether you're using your anterior muscles or the posterior muscles. Doing a squat, take a squat all the way down. If you want to look at a squat, you're basically getting a lot of information from a squat. You're getting ankle range of motion, knee range of motion, hip range of motion. You're also getting flexibility. You're getting strength. If someone has an ankle problem, a knee problem, or a hip problem that's going to interfere with them participating in sports, what's going to happen is that squat is going to show it up. There's going to be a lot of compensation going on there. But also you see their balance and their strength. After that, we're doing cervical range of motion, and also we're doing the cranial nerves. Now, we're not checking every cranial nerve, but we're checking the important ones. We're assuming if they can hear my instructions, that they can hear, and if they can follow my commands, they can see what's going on. Remember, this is a screening, not a physical exam to find out what's wrong. The cranial nerves we're looking for is their ability to track, their ability to see, and also the spinal accessory nerves, and also the trigeminal and the facial nerves. Now, we also, when we follow up, we've done lower extremity strength already with the squat, but as they shrug up their shoulders, we get spinal accessory, we get upper shoulder and shoulder stability, and then when they squeeze my hand, we're getting gross strength of the upper extremities, and you should be comparing right to left. Okay? And then as they sit down, as you saw before, we start off by listening to the heart, looking for normal rhythm. Then we go to the back, listen between the shoulder blades for normal air passage. And then also we're looking at their blood pressure, obviously, and checking that out, and also doing a 15-second pulse times 4 to get their pulse rate. And then the last question is basically asking them if they have any pain in the stomach or groin, which could be an indication of some type of maybe a hernia or pre-hernia condition. That's the pre-participation physical. It's also a great way if you're just doing general screening of people to check them in general to see if they can function. So I hope that was helpful and will help you increase your ability to do physicals and do examinations and doing it in an organized and in a very, very efficient manner. This is Dr. Buckley.